Imagine this. The surgeon sits down and says, "We should operate next week." Your family looks relieved, but your stomach drops. Something about the certainty feels too fast. Do you sign today or press for another view? That tight, split-second feeling is exactly what we're unpacking tonight.
Hi, I'm Jess. I'm a family nurse practitioner and legal nurse consultant, and this is the space where healthcare, law, and real-life situations intersect. Let's separate medical fact from fiction.
Tonight, I'm giving you a really practical playbook, not theory. You'll get a short checklist, scripts to request records and consults, timing targets you can actually use, and the red flags that say stop, recheck, or escalate. By the end, you'll know what to gather and what to ask, so decisions feel clearer.
Okay, quick question. What is a second opinion, really? In plain terms, it's having another qualified clinician independently review your diagnosis or treatment plan and tell you what they would recommend and why. And let me be blunt. Asking for one is not an insult. It's a safety step. I tell patients, I want us to be sure, not sorry.
A quick rule I use in clinic, 7 red flags that make me say, call for another opinion. Here they are fast, and I'll pause between the ones that matter most. Major surgery, a rare or uncertain diagnosis, treatments with high risk, conflicting advice, symptoms that don't improve, pressure to act immediately without options explained, or if you just feel pushed. Micro example. I cared for a woman told she needed a full hysterectomy after 1 scan. She asked for a second opinion. 2 more reviews showed a benign cyst that we safely monitored for 6 weeks instead of rushing to surgery. That's the kind of difference a second voice can make. So, where do you go? Start with specialists in the field. If your problem is complex or rare, academic medical centers and teaching hospitals are strong choices. They often run multidisciplinary reviews. But there are other options: reputable second opinion services, telehealth subspecialists, and even independent reviewers with fellowship training. A couple of quick checks for expertise: board certification in the relevant specialty, fellowship or subspecialty training, and recent case volume. Don't be shy. Ask the clinic, how many similar cases do you see annually? That's not rude. It's smart matching. Now, paperwork. Before you request a consult, gather the essentials. Short checklist first. Problem timeline, clinic notes and discharge summaries, imaging with reports and the DICOMs if you can, labs, pathology reports, and a medication list with start dates and reactions. Then write a 1-paragraph summary of why you want the second opinion. Why DICOMs? Because seeing the original images, not just a PDF report, lets the consultant scroll through the study. It often changes answers, so ask for originals when possible. When requesting records, use direct, calm language. Try this. Hello, my name is... your name. I'd like copies of my medical records, including imaging and operative reports, for care between dates. I'm requesting them to share with a consulting specialist. Which forms do you need from me? That gets the right people moving. Short pause to breathe here. Paperwork is ordinary, and it's your safety net. Keep a simple log: who you called, the date, and any confirmation number. That record becomes powerful if there's delay or a dispute later. How do you present the case? Think 1 crisp brief: who you are, the main problem, key tests and dates, and the decision you're asking them to weigh. Example line to a consultant: I'm a 58-year-old with a CT from April showing X. My surgeon recommends Y. I'm requesting an independent review of the images and options, especially non-surgical choices. Short, factual, respectful. Priority questions to ask. Keep them to 3 so answers stay focused. 1. How certain is the diagnosis? 2. What reasonable treatment options exist and their risks and benefits? 3. What happens if we wait or try something less invasive? Also try, what would you do if this were your family member? That often gets a plain, honest answer. Expect differing opinions. That's medicine being honest about uncertainty. Don't count opinions like votes. Compare reasoning. Does one clinician cite imaging, pathology, and guidelines? Do they explain alternatives and timelines? If someone offers a guarantee or refuses to discuss downsides, raise an eyebrow. Red flags to stop and reassess. Pressure to decide now with no records to review. Refusal to share imaging. Promises of a perfect outcome, or dismissal of your questions. If you see those, pause and consider a multidisciplinary review or a third opinion before irreversible steps.
Let's talk timing. Listeners always ask this. For urgent situations where delay risks harm, arrange an expedited review immediately. Hospital-based consults or transfers may be needed. For non-emergency decisions, aim for a second opinion within 48 hours to 2 weeks, depending on the complexity. 48 hours if something is uncomfortable but not crashing. Up to 2 weeks for more elective planning. That gives you clarity without unnecessary delay. Insurance and referrals can slow you down. Workarounds that actually help. Ask the consulting center about self-pay review fees. Use telehealth consults to avoid travel delays, and involve a hospital patient advocate to push records. If insurance declines, sometimes paying privately and then appealing later gets you the speed you need.
I know all this can feel like one more thing to do when you're already tired. So let's make it small and usable.
Your one-page checklist. Say it out loud and tuck it in your wallet or phone. 1. Why a second opinion? Short trigger note. 2. Records gathered. List items and dates. 3. Potential consultants. Names and credentials. 4. 3 priority questions. 5. Timeline target. Urgent versus elective. 6. Log of requests. Dates and contacts. That's it. Simple and actionable.
Scripts to keep relationships intact. To your treating clinician, say, I value your recommendation and want the safest choice. I'd like a second opinion to review the imaging and options. Can you recommend a specialist or provide the records I'll need? To a consultant, thank you for reviewing this. My questions are X, Y, and Z. The imaging was done on date. Honest and respectful gets faster cooperation. A quick reality check. Second opinions can reduce risk, but they can also raise anxiety. Use the checklist to stay focused. Set a timeline. It helps prevent endless searching. And bring a trusted family member or advocate to appointments for support and note-taking. Before we close, 3 takeaways I want you to remember. 1. Gather essentials first. Notes, imaging, ask for originals, labs, meds, and a 1-paragraph timeline. 2. Ask targeted questions, certainty, alternatives, and the cost of waiting. 3. Compare the reasoning behind opinions, not personalities. If you see red flags, get a multidisciplinary review or a third opinion. If this episode helped you feel more prepared, please subscribe so future practical guides land in your feed. Share this with someone facing a tough medical call. It might be the clarity they need. Thank you for listening. If this episode clarified a medical or legal question or made you think differently about how emergencies and accountability intersect, that's exactly why this podcast exists. I'm Jess, and I work with attorneys, organizations, and professionals who need clear medical insight in complex cases. You can learn more or schedule a consultation at faqbynurseJessconsulting.com. If you found this episode valuable, please share it, subscribe, and leave a review. It helps this education reach the people who need it most. Until next time, stay informed, stay compassionate, and always put safety first.